All right, welcome back, friends, and a big thank you to Erin Newman for filling in today. She's crushing it.
Thank you.
Well, we're going to get a little serious here on this segment. Often we speak about concerns around women's health. We talk about breast cancer.
We sure do. But there can be multiple reasons that a mammogram can come back abnormal, and it doesn't always mean cancer.
That's right. So here with more information about benign breast conditions is Megan Kime. She's with the Minnesota Oncology. So good to see you. Thanks for being here.
Thank you for having me. I'm really excited to be here.
Yeah, so this is a serious conversation, but the benign breast conditions, not as serious, but something that you guys treat at Minnesota Oncology. So could you just tell us exactly what is a benign breast condition?
Yeah, benign breast conditions, the category is so broad because it's anything that happens in your breast that is not cancer. So it is a lot.
Yeah.
Probably a lot more than I'll be able to cover in the next few minutes. But
I think we've been trained, though, as women, you go for your mammogram and you think it's only to detect cancer. So it can be kind of shocking to say there's something happening and it's not cancer.
Yeah, when I think about benign breast conditions, mammogram is a way a lot of them are found.
Okay.
And they kind of fall into three categories. There can be abnormal cells, something we call hyperplasia, where the cells are just a little bit more reactive than they should be. There can be benign breast tumors, so you might have a mass in your breast that needs to be removed, but it's not cancer.
Okay.
Sometimes they need to come out, sometimes they don't. The third one can be like infections. A lot of women get mastitis while they're breastfeeding, but you can get it other times as well, and there's some inflammatory versions too that can be really difficult to treat. So we see a lot of things that don't end up being cancer.
Wow. I have to imagine, though, if mammogram is probably the best way to find this stuff, but if you have an infection there, that's got to be painful, right? So are all of these things, the other conditions that you find, do they have symptoms where you would feel them or no, but only really detectable under that condition with the mammogram?
It's 50-50. Wow. Things like the infections and the inflammation, you're going to feel that. Those are the things that women are noticing at home and saying, hey, something's not right, and going to see their OB and maybe getting referred to us or coming straight to us. There are certainly some things that are only found on the mammogram. Some of those little hyperplasias are just a couple cells that might look a little funny on your mammogram and might need what they call that second look.
Right.
Mammogram or a biopsy even to make sure they're not something more worrisome. So there are a few different ways we can find things. And
so basically kind of the same thing we should be doing looking for cancerous cells is the same type of things you'd be doing looking for abnormal or non-cancerous conditions.
Correct.
Okay.
And the interesting thing is some of these hyperplasias can actually tell us a little bit about your breast cancer risk. So even though they're not cancer now, we might look at a certain biopsy result and say, hey, this isn't cancer, but it kind of tells us that maybe your breast tissue is more prone to forming cancer and we should screen you different ways.
Oh my gosh, that would be so nice to know. Because I think a lot of people they're constantly worried. Am I doing my mammograms on time? Am I doing my self-checks? You know, you get worried. So knowing that there might be little precursors that could help you navigate your plans for the future would be amazing.
Absolutely, and it changes the way that we want to look at women's screening, so it becomes good information. I always say all data is good data. We want good information and we'll use it, so we want to get that data. Even if it's scary to get that, abnormal mammogram, sometimes it tells us good things.
That's the thing. I mean, we go through so much in our bodies, we don't know what's going on, and to have that peace of mind, that knowledge of like, okay, we found something. It doesn't have to be scary. And if you're in that situation, then what is usually next? If you guys come out and say you diagnose it's benign of one of these three conditions, what's the treatment look like? Is it surgery? Is it medications? How do you guys treat it?
D, all of the above. It really depends what it is. And I think that's where we are blessed in the Twin Cities with a lot of really, really good breast radiology groups that go through, read those reports, they look at the pathologist looks at the biopsy results, and then the radiologist will chime in, yep, that makes sense, we should do this. And so a lot of those reports that patients are seeing have the detailed next steps on there from the radiologist. We should do another scan in 3 months, another ultrasound or something. You should be referred to a breast specialist or someone like me. You should be referred on for an additional imaging. So usually they give really good recommendations in the report about what to do next, but we can always help. If something, if you're confused, if you have questions, if you have an abnormal result, then you come and talk to us and we figure it out together.
Nice.
Yeah, when it comes to the testing then, I feel like there might be just a lot of information about like when women should be getting the mammograms.
Yeah.
Well, so kind of a two-part question. Is mammogram still the best device to detect, cancerous, non-cancerous? And then at what age should you start doing that?
Absolutely. Mammogram is a great screening test. It's always going to be our first stop. If we could, what it shows really, really well is those abnormal cells.
Yes.
The different hyperplasias, things you wouldn't feel yourself, but you still want to know are there. It can also show the stage 0 breast cancers really well. So you always want to find things
Very
as early as
helpful.
possible.
Yes.
So that's where mammogram is always going to be the best. There has been a lot of confusion. I feel bad for anyone trying to figure out when do I get a mammogram, when do I start right now, because there's a lot of conflicting information out there. And the trouble is that it's conflicting on our medical side of things too, because we have the American Society of Breast Surgeons, we have the American Cancer Society, we have all of the different bodies coming together to give recommendations, but they're all recommending something different right now.
You're right.
If you ask anyone in the business, any of our breast specialists, our breast surgeons, our team, we're all going to say, if you're average risk, start at 40 and get a mammogram every year. There's been a big increase in breast cancers in younger women, so that the 40 to 50-year-olds need to be covered. I think they were trying to eliminate that a few years ago, but a lot of the organizations are really coming out and saying this is important, start at 40.
Yeah.
And do you have a 2D, 3D? Do you ever talk about that, or is it whatever you decide with your doctor?
I think it's a good question to ask your radiologist if they have a 3D option.
Okay.
If they do, insurance is almost always covering it.
Got it.
So just pick it.
Okay.
But especially if you are someone who's told you have dense breast tissue, you gotta ask for the 3D.
Okay, and that's something we can ask for now.
You can ask for it, yeah.
Nice.
Yeah.
Yeah, well, this has been awesome information. And again, everybody out there, all the ladies out there, get the exams, get the mammograms, and it doesn't always have to be scary.
No, it doesn't. And I think the biggest takeaway that I want women to know is that trust your instincts, trust your body, you know yourself. If something doesn't feel right, if you read your mammogram report and you still have questions, if something is just bothering you, come in and see someone. There's no reason not to come in and ask. That's what I'm here for. So
thanks for clearing everything up.
Yes, thank you, Megan.
Really appreciate it.
Thanks so much for having me.
All right, so to learn more about cancer treatments and providers, Minnesota Oncology is the Twin Cities' largest and only independent cancer care provider with more than 100 experts, including their breast specialists and their team in 13 locations.
Awesome.
You can learn more at twincitieslive.com.
Well, buying a car can be stressful.
Yes, it
can be a very stressful experience, but now add on a disability like being deaf or hard of hearing, and the concerns definitely add up.
A very long process for me, a lot of misunderstanding, misinformation, maybe making the wrong choice on a big purchase. That was my biggest fear.
Last 28 years.